Next letter in our love acronym is V. This stands for vaginal health and sperm-friendly habits. So to tell you a bit about this one, I want to take it back to a patient I saw a long time ago. They were struggling to conceive, and when I'm taking lifestyle and learning more about their intercourse, I came to realize that they're using quite common lubricants during their intercourse. Now, they were using things like KY jelly and even olive oil, but what they didn't know is that these kinds of lubricants can actually damage sperm. So what did I do? I advised them to stop using those lubricants and switch to a fertility-friendly lubricant. And to be quite honest, not a lot of people know about this. In fact, some lubricants even have spermicidals in them as well. So now, in addition to this, remember, smoking reduces fertility for both men and women. It also increases miscarriage and preterm birth. Alcohol, 1 drink every other day. Obviously, having alcohol-free days is fine, but more than 1 drink a day, so 2 to 3 drinks a day, this can lead to infertility. And remember, I'm sure you know this, once pregnant, no alcohol is safe. With regards to caffeine, more than 4 or 5 cups a day can affect fertility. And during pregnancy, more than 2 cups of coffee a day can increase your risk of a miscarriage. So in terms of how much caffeine should you have, if you're trying to get pregnant and you're struggling to conceive, I would probably say try and avoid coffee and caffeine basically. But if you really can't, live without it, I'd say max it out at about 200 milligrams of caffeine a day. Each cup of coffee has about 100 milligrams of caffeine in it. Next, let's talk about marijuana. Women that use it are about 1.5 times more likely to have infertility. And men who use it generally have about a 30% lower sperm count. And by the way, this effect might be worsened if combined with cigarettes as well. And other harmful substances, dry cleaning chemicals, pesticides, heavy metals. Patients quite often ask me about sex positions, lubricants, orgasms, and frequency. In terms of position, no specific position helps more. You don't need to do anything crazy. You don't need to lay upside down for 15 minutes. Sperm moves fast. It can reach the egg in about 2 to 15 minutes. In terms of orgasms, they're not needed to get pregnant. In terms of how often, I think this is a good question. For men, long gaps of 5 or more days between ejaculation can actually reduce sperm quality. So daily ejaculation for men is okay, particularly for those who might have a lower sperm count.